Bovine respiratory disease, commonly known as BRD, is the most common and costly disease affecting the North American beef cattle industry. The Beef Cattle Research Council states that BRD accounts for 65 to 80% of the morbidity, sickness, and 45 to 75% of the mortality rates in some feedlots. BRD as a whole is described as infections of the lungs that then cause pneumonia in the cattle. BRD can be caused by multiple things. One is by host factors, meaning characteristics of the animal that make it more susceptible to sickness, such as age, immune status, and prior exposure. Another way is through environmental factors such as transport, commingling, temperature fluctuation, and crowding. All of these are risky situations for cattle. The stress caused by these factors weakens the immune system and allows for an animal to be more inclined to become sick. The third way that it can be caused is by pathogens. These can be things such as viruses like IBR, BVD, and BRSV, and parasites like lungworms. Signs of BRD include fever over 104 degrees, difficulty breathing, nasal discharge, depression, diminished appetite, and secluding themselves from the other animals in the pen.
The method uses a double-guarded swab that travels to the bottom of the nose and samples the back of the throat. 2 swabs are collected from each animal. 1 swab is then placed in a bacterial transport media, and a second swab placed in a vial. The samples are then sent chilled overnight and delivered to the laboratory and tested for BRSV, BHV, BCOV, BVDV. The samples also are streaked on selective media and cultured in a 5% CO2 incubator for BRD bacteria. This also gives producers a better understanding of what antibiotics can be used to prevent BRD in their herds.
So she was just so if you feel sick, you don't really want to do anything, and she was in the same matter. She was standing away from the crowd, she wasn't interacting with anyone, and then, like I said, one big sign that I had was she didn't come up to the feed bunk to eat when the new feed was in the bunk. So it's more of looking at how their behavior is, and then by that if we feel like they might have something wrong, we'll bring them up and then we'll just tempt them, because for BRD what happens is they get the infection in the lung, and that is going to cause a rise in body temperature. So if it's above 103, I would call it as a respiratory, and I'll just treat her with some
disorders not fully understood, and the ways to prevent these has not been discovered yet. Over the years, we have relied on vaccines, antibiotics, and antiparasitic drugs to keep our cattle in good health, but there has always been a concern of microbial resistance to these treatments. Next-generation sequencing provides important opportunities to resolve these concerns associated with pathogenic illnesses. Some important topics that next-generation sequencing has started to solve is tracking disease progression, identify the pathogens involved, and map pathogen interactions with the host. The use of genomic tools has helped in the treatment development as well as successful breeding programs that have less susceptible livestock. These tools have also helped in the decline of infections.